Greetings, everyone. Welcome to another Prep Hour with Steve. Today is December 16. It's just gone 5 p.m. in Brisbane on the east coast of Australia. And I hope this finds you well. Lots of people here. Hello to Ali. Thank you for the compliment. Hello, Ayosh, Veena. Hello, Maria and Nestia. Lots of people here. Good to see. Hello, Rupinder. I see Nista has an exam on Saturday. So yeah, type that in, everyone. There's an exam in about 2 or 3 days' time, December 18 or 19, depending on your location. I'm sure some of you have that exam on that day, so good luck. And I hope our little bit of preparation today guides you a little bit there. I'd get you all to also just type in your location and what time it is. And while you're doing that, I'm just going to check all my channels, make sure I've got all my communication working there for me. Just check out my chats, everyone. So we're live, we're streaming live on OET Online Facebook page, on the OET Center Facebook page. We're also on 2 YouTube channels. We're on OET Online YouTube channel, and we're also on the OET Center YouTube channel. So that is wonderful. I'm just going to set up one page here, everyone. I'm just looking for set up on one page. Just bear with me 1 sec, everyone. I'll just bring my other screen up here and just let me set one thing up for you. Bear with me, I'm still here. All right, just one more thing to check. Just checking a couple of channels, everyone. Just bear with me 1 sec. I don't seem to be streaming everywhere that I want to be. See if I can get my Facebook one going on the OET Center channel. Just 1 sec, everyone. There we go. I just want to do the messages. Yes, I can see that. Greetings.
Your face is your moneymaker, so why would you pair it with cheap plastic?
All right, and we are good to go. All right, I can see people from lots of regions. Hello there in Pakistan. Hello there in Brisbane, where I am. Hello to Sudan. Hello in Jordan. Greetings there in Muscat, Ireland, Zimbabwe, Birmingham. Where I am, Ali, it's 5 p.m. Hello to the Philippines. Hello there in Dammam. Jordan, I think. Correct me if I'm wrong. Hello to Peter Pratt's in Czech. And hello, Marketa people I know. Hello there, Bahira in India. We have Nigeria is here. Hello, Nigeria, Ghana. So we're reaching into Africa. That is wonderful. Hello to Mumbai. Hello there in Riyadh, Bangalore, lots of different places. Okay, that's fantastic. Hello in Kuwait and Egypt. Excellent. Hello in Qatar and Afghanistan. Hello, Nasib over there. And Lesotho, hard to pronounce down there within South Africa. Good to see. OET is such a global exam, everyone. And isn't it fantastic that we can all be together in one place? All you guys as health professionals, all in one place, just going through the motions, getting ready to pass OET, so you can be working together in the future for the public good. Hats off to you and well done, everyone. Okay, this is the last session of 2020, everyone. We've had a busy year. Hasn't it been a crazy year? There's been ups and downs, and there's still a lot of tough times, but it is good news that there has been progress on the vaccine, and I hope whatever part of the world you're in or whatever work you're doing, I wish you well, and hope that you and your loved ones and your patients are all getting through this time, and that we have brighter days in the not too distant future. In the meantime, there's an exam to take and things to do, so we're here to help you with that. Okay, so I've got my slide here, everyone. So we'll talk through this. So as I said before, we're on Facebook and YouTube. And don't forget, you can visit OET Online at oetonline.net.au. And just so you know, we have, if you want to find out what our courses are about, check out the free trial course, everyone. We have weekly orientations, sample practice tasks, placement tests. There's a prep hour, information is there. It's all free. So do check that out, everyone. I'll just give you the direct link if you do want to check out our free trial course. And perhaps if you're interested in a course, this is where you can enroll. Many people do, and many people succeed. All right. Okay, just putting that message in there, and I'll just put that message in here as well. That's where you can do it, everyone. And also on my YouTube chat. So I'm monitoring a few different chats, everyone. Okay, let's get this started. So today, everyone, I wanted to talk about signal words and information flow, because I think it's a very important part of OET writing. So it does refer particularly to writing, and that's what's going to be our focus. Signal words and information flow. Information flow is very important when you're writing a medical referral letter, because you want your reader to be able to understand what's happening to that patient. So getting the information, the history to flow smoothly, very, very important. So what type of signal words or what categories can we put them into? Well, I'm going to get you guys to type in some information, but I've got some information on the left. So we have signal words to describe time, signal words for location, signal words for reason, signal words for contrast. There's signal words for result, emphasis. We can use signal words for empathy to give us our subject, and we can use signal words for advice. So there's plenty of them, everyone, and you can see them on many medical referral letters. So question to the audience, everyone. Give me some time references that you know of that relate to time. Just type it in, everyone, and I'll just check your comments there. And I'll put in a link there for YouTubers. Signal words that relate to time. Think about your patient. You're describing a patient history. Perhaps they were admitted to hospital on a certain day. They've been in hospital for several months. They've made progress. Then they're nearly ready to discharge. And you've got to express that timeline. All right. Well, while I'm waiting a few things to come in, I might give you a few ideas. Here they come. Starley's got one. Initially, we've got onset. Good. The onset of disease. Since works. Yes, that's great. Keep bringing them in. Prompt. not quite sure. Prompt attention maybe. On today's visit, earlier today, recently. Yeah, everyone's on track here. So, yep, during hospitalization. So I've got a few, everyone. Initially, 3 months ago, at that time, 2 weeks later, on her next visit, since that time, recently, over the past 3 weeks, currently on review today, on a particular date, on the 16th of the 12th, 2020. And so these are all common ones, and people are putting in before and after and later for recently. These are all great. And when you use these, as you'll see in today's lesson, you've really got to make sure your verb tenses are in alignment. That's time, everyone. Then we've got location. I'll run through these for you. During hospitalization, on examination. I've only got one here for reason, due to. The patient was admitted to hospital due to a suspected fracture, so giving reason. I like due to because it's very short. Contrast is common. We know that our patients' medical conditions are often complex, and that treatment doesn't always go according to plan. There could be issues with compliance or side effects. So there's often contrast that needs to be expressed. However, despite, although, while, as, yet, you need to be confident with these. Results, sometimes we need to look at cause and effect and the result, so we can use therefore, as a result, hence, nice and concise. We've got emphasis. Please note, my main concern is what concerns me most. A question's coming through from Sarah. What's the difference between for the past 2 weeks and over the past 3 weeks? Very similar, and they can be interchanged, Sarah. But for often indicates it was continuous, so the patient has, had worsening symptoms for 3 weeks. That means it was continuous. But the patient has had headaches intermittently over the past 3 weeks can indicate it wasn't constant. So there's some subtle differences there, but sometimes they can be interchanged. So you've got to think about what you're describing. Empathy. Sometimes we do use words like unfortunately or regrettably, but you've got to be careful with those words. You can use unfortunately. Unfortunately, the patient's condition has deteriorated or their cancer has metastasized. If it's a significant decline in their condition, it's acceptable to show a little bit of empathy, but only for those situations. Careful not to use those words. We've got words for subject, lots for subject. Good thing about OET, you don't have to write a topic sentence like in other exams. Often you just need a phrase that indicates what the topic will be. Short and sweet. In terms of a social history, with regard to a medication, based on the blood test results, regarding her medical history, her dental history shows, the risk factors include, treatment to date includes. So lots of phrases you can use they act as signals and they tell the reader what you're going to write about. So lots of these things are very useful. Occasionally, for some professions, you need to give advice, particularly if it's a letter to a patient. Pharmacists, that's common. Radiographers have to do this. Nurses on occasion. So if you are giving advice, it's important to, I recommend plus ing. Please ensure that we can use these phrases. So there's just some basic signal words, everyone. But what I find as a teacher is people tend to overuse signal words. And if you overuse signal words, that is going to create a problem, right? And I want to give you an example of that. So these are fantastic words, but use them with caution. Use them in the right place. Look at its samples. Look at model letters to identify the pattern. So here's an example, everyone. So we've got signal words that I really think you should avoid. So the first one is besides. We don't really want to use besides, right? Because it's informal. You know, besides this or besides that, just sounds a bit informal. Options, nothing. If you think you're going to put the word besides, my advice is put a full stop and just write the next sentence. Especially if the connection between the two sentences is clear and doesn't require a signal word. Now we've got a word like then. Then is spoken English. However, it can be used, and you're going to see it in our example today, we can use it mid-sentence. And I'm going to show you how to do that in today's lecture. Firstly, secondly, thirdly, finally, not really suitable in a 200-word referral letter. You can use it for giving advice, but I think that perhaps may belong in your speaking role plays when you're advising a patient on what to do and you're making a list of the steps, not so much for writing a medical referral letter. Moreover is a tricky one. It can sound a bit contrived in a medical referral letter. I would generally say avoid it. It's used more in essays. If you do want to use moreover, if you've got extra information, also is a classic word to use. But my suggestion of also, it's better mid-sentence, which is the example here. Use mid-sentence and place before the main verb, but after any auxiliary verbs. I'll give you a little example of that, everyone. I'll make this a little bit bigger. A little example of that, everyone. So if you wanted to use also, don't do this. Also, what's a good sentence I could write here? Also, he has been experiencing back pain. That's a new sentence. I find that breaks the flow a little bit. My suggestion for you, don't really want to use moreover there. What we can do, we can write he has, and then we're going to put also after our auxiliary verb, which is has, right? So this is where you place it, everyone. After the auxiliary verb, but before, this is the passive or for the progressive, and before the ing, the main action verb. He has also been experiencing back pain. You'll find that creates better flow. Now, Sarah asked, can we use in addition instead of also? You can use in addition, but I would use it cautiously. I'd be cautious with that word. I wouldn't overuse it. There are occasions you may use it once to give some additional information, but try not to overuse signal words, as you're going to see very soon, everyone. Right, I'm going to continue. On the other hand, you don't want to use on the other hand. You know, the patient is a smoker. On the other hand, they don't drink. Too wordy. It's lacking conciseness. Save it for any essays you might be writing. Just use but or however. But for mid-sentence, however to start a new sentence. Meanwhile is a bit informal. You've got to get some different sentences, different expressions. It's a classic in the interim, right? In the interim. It's while something else was happening, but don't really use meanwhile. Actually is informal. Replace it with nothing. You don't need that sort of word. It's a bit emphatic, too much emphasis. We can remove it. It's important to note, well, if you're writing to another nurse or doctor or pharmacist, another health professional, you don't really need to tell them what's important. You simply say, please note. Please note is standard, everyone. You don't have to tell them what's important. They will know. They're health professionals. Your job as a writer is to be objective and give facts. So remember, with signal words, they're useful, but we're talking about giving objective information, fact-based information. Let me continue, everyone, and you'll find out more about what I'm talking about. All right. Now, can everyone see my screen clearly? Just type in yes if you can. One student saying the words are not visible. I think they should be. I'm assuming you can all see my screen, everyone. Okay, I'll keep going, everyone, and just type in yes if it's very clear for you. And we're going to talk about some common errors that people make, everyone. Now, Siddhartha says, can we use of note? Absolutely. And I'm getting lots of positive feedback there that people can see my messages. Excellent. And as is a good one, yes. And you're absolutely, as is wonderful. Okay, let's continue, everyone. And it's crystal clear here. Wonderful. Thanks for that feedback. Okay, so we've got this, everyone. Let me read it. Initially, on 12/10/20, I saw Mr. Jones when he came for a checkup. In addition, his blood pressure showed a mild elevation. Also, his weight was above the normal limit. And we've got some information. Moreover, the cardiovascular examination and the urine analysis were normal. Therefore, I advised him to lose weight and to stop smoking cigarettes and to come for a review within 1 month. Besides, a prostate-specific antigen test was requested before next visit. What do you think of that, everyone? I've got wrong, so it's not wrong, but it looks a little bit contrived, doesn't it? It's just got too many linking words and they're not necessarily used correctly. And I wouldn't call that objective writing. I'd say the reader's they're actually acting as distractors to the main idea, because remember, your reader most of the time is another health professional. They want the facts. They want to know what's wrong with that patient. They don't need all this large number of linking words. What do you think, everyone? Do you agree? They don't need all this information. 2 wordy, says Sonia. Yes, it is. You've added all these extra words, so your word count's going up. And Sarah says, sounds a bit informal. Well, it sounds IELTS-y, dare I say it. It sounds like someone's prepared for a different exam. Someone's been practicing their essays, but not really thinking about what a medical referral letter is. A medical referral letter, everyone, is a report. It's basically a report written in a letter format. It's a reporting of your patient's history. That's what it is. So let's fix this up, everyone. All right, and I'll show you how to do this. So this is a little bit better. You watch the changes. I first saw Mr. Jones 2 months ago. Now, I could have said on the 12/10/20, that's fine, but I do like to use some different ways. Like 2 months ago is quite clear to the reader. They don't have to do that. If you write 2 months ago, they don't have to think back. Okay, when was that? So putting time references like that is quite useful rather than specific dates. But dates can be used, but this shows a bit of variety. I first saw Mr. Jones 2 months ago when he came for a checkup. Now this says in addition, but we can use a time reference. At that time. Now, putting at that time is very useful, everyone, because you're creating cohesion here, right? So at that time, his blood pressure showed a mild elevation. Now this said also, but we don't want also, as I said before, we don't want also to start a sentence really. His weight was also above the normal limit. Goes very well mid-sentence. Now we've got a moreover. What do we put there? However, because there's contrast, everyone. Because we've got, it says here his weight was above the normal limit. His blood pressure had mild elevation. These are negatives. But then we've got cardiovascular examination and urine analysis were normal. That's a contrast. So moreover doesn't actually work. It creates the wrong meaning. If we use moreover, we're expecting another negative symptom. But in this case, it's a positive symptom. So we need contrast. So however, the cardiovascular examination and the urine analysis were normal. Now here we've got therefore. Therefore, I advised him to lose weight. Now you can use therefore. You advised him to lose weight because his weight was above the normal level. However, we don't have to say cause and effect when we're writing to another doctor, not even as a result, Hashal. Quite often, the best signal word is no signal word. Just write your next sentence. I advised him to lose weight, to stop smoking, and to come for a review visit within 1 month. Sounds a bit funny. I've just said in 1 month, a bit more direct. Basir is saying, could we use hence? You could use hence, but the point I'm making is we don't need to use a signal word between all our sentences because we're writing objectively. A prostate-specific antigen test was requested before the next visit. This is before next visit, so we can use before. Someone mentioned that earlier, but don't forget to use a definite article because we're describing which visit, not the last visit, but the next visit. Okay, all right. Jissa says, can we use values within brackets? Absolutely. It's good to use values in brackets if you think it's relevant to the reader. It's a nice way to add that little extra fact. It's common in medical writing. Ali says, can you shed some light on better use of comma? Yeah, well, we'll save that up for another one, Ali, but not today. All right, so let's clear all. Commas is its own lesson, that's for sure. All right, I'm continuing on. All right. So let's talk about a particular type of signal word, everyone. A particular type of signal word. So I've got 3 tips for you, everyone. Here they come. Number 1, signal words link sentences together. They help you paint a coherent and logical picture of a patient's health. They're excellent. Used correctly, they enhance your writing. They make it easier for the reader to follow the timeline and extract information. Very, very good. However, used incorrectly, they can break the flow of information, possibly even confuse the reader. That's not a good thing. So the point is, medical correspondence should be objective and factual. So that means if the relationship between ideas is clear, remember you're writing to another professional, they know. If it's clear and obvious, you don't need to use a signal word. So remember, don't overuse signal words. In my opinion, probably the most important signal word in a medical referral letter are the ones which represent time, because you're describing a patient's history. The timeline is all important. Do you agree, everyone? What's your feeling about that? Do you think time is most important? You've got a patient's history. I can give you this graphic here, everyone. We've got a timeline. We've got an initial condition. We've got a progression, perhaps the patient's recovering and is ready to discharge back to the community, or perhaps the progression, their condition is getting worse and they need to be admitted. That's your progression. And then you're talking about now. So this is really common in a medical referral letter. You're summarizing the progression of an illness. Now, in terms of verb tenses, when we are doing a timeline, it can be tricky. Simple past is often used for the initial condition. For progression, we may use some simple past and also present perfect, depending on what we're describing. And then when we're talking about the current situation, we may use some present perfect and also some present tense. And that's a bit of a summary of it, but it's more complicated than that. Verb tenses and time references are something that require careful analysis and review. And I'm going to give you a few examples now, everyone. Okay, so here we go. So this is a case, everyone. Now, the case we're looking at today, it's Jake Peterson. If you want to know where I'm getting this case from, everyone, this is actually an OET Center case. This is OET Center task number 4, everyone. If you want to look at this yourself, you can actually look at it via this link. It's on the OET Center website. It's a nurse task, everyone. And it's task number 4. All right, that's task number 4. That's actually what we're looking at. I'll just show it to you on this. Here it is, everyone. This is the OET Center website. That's where I am. I'm on their prepare page, and I'm looking at their sample writing tasks. And we're looking at sample number 4, everyone. So check this out yourself later. It's a case of Jake Peterson. Now, I'm just going to summarize that today because there's a few things I want to point out. It's a very good example. Now, poor old Jake, he's got alopecia areata. And to give you a bit of background on this case, the letter's coming from a school nurse, and she's got to describe his history. He's been a student at this school for over 5 years, or coming up to 5 years. And he's about to get transferred to university, or not transfer, but he's about to start university, and he's worried. Now, the nurse has to describe his history over a 5-year period. Quite a challenge for a writing task. So I'm going to show you how you can approach something like this, everyone. So here's the summary. He had hair loss at the age of 13. This is when it all started. Poor Jake suffered from hair loss. And then between 2014 and 2018, he went into remission, everyone. He went into remission. That's a time period. So we're going to have to describe that. In December 18, his symptoms returned. In February 2019, there was unsuccessful treatment. Then in May 2019, there was an increase in alcohol consumption. Jake was getting stressed and was turning to alcohol. He was 18 by this stage. In June 2019 to July 2019, poor Jake had exam stress. That caused a worsening of his symptoms. Finally, he's ready to go into university and he needs a referral, right? So in this letter, based on these case notes, the job is to summarize that patient's history over a 5-year period. All right. Sound easy? Sound hard? Well, let's see, everyone. So let's break down how we would do it. So we've got his presenting complaint, everyone. Hair loss from 13 years old, intermittent cycle. Okay, so that's from the case notes, everyone. How are we going to paraphrase that? Well, we're going to use some time references first, right? First and when. Now, verb tense, as I said before, this is the initial condition, so we're going to use simple past. Let's see how we do it. Jake first something with hair loss when he something 13. What words can we put in here, everyone? I'll give you all a moment to think about that. A lot of these I'll do myself, but I'll just give you a chance to get started. What words do you think could fit into these gaps? Jake first something, we've got to use simple past, with hair loss when he something 13. I'll give everyone a moment just to put in their content. And if you're watching the video at whatever point in time it is, you can consider what you would put in there, everyone. Yosh and Danielle fast, yes. When Jake first presented with hair, Jake first presented with hair loss when he was 13. Done. And that's a nice sentence. We know the start point. Nice and simple, not too complicated. All right, then let's see what happened in May, everyone. Prescribed steroid cream, betamethasone dipropionate. We've got the dosage, but this is an interesting one. We've got personality changes, aggression, sleep loss, medication discontinued. So I want to use after this time, but one thing I want you to think about when you're summarizing the history on exam day or when you're practicing, really think carefully about the order of events. And when you want to present information, just think about what happened first, what happened second, and what happened next. And then you can follow that pattern and write quite clearly. Let's have a look. So first, there was a prescription. Then he suffered side effects. Then the meds were discontinued. So we're going to use simple past again, and we're going to use a gerund form of the verb. We're also going to use some passive voice here. All right, help me out, everyone. He something steroid cream, but after something personality changes, aggression, and sleep loss, he something the medication. What are we going to use to fill these gaps, everyone? To create a clear order of events. What actually happened? 1, 2, 3. This is the skill you need when you're summarizing case notes. Okay, answers are coming through. He was prescribed steroid cream, but after, now this is a tricky one. What comes after? After is a preposition, so we need a gerund, everyone. Commence could work as well. Different things are coming in. Something personality changes. So what verb suits personality changes, everyone? But after something personality changes. Ayosh is on track, but we can't say experienced. Yeah, people are getting it, experiencing. Thank you. That's correct. But after experiencing personality changes, aggression and sleep loss, now I'll help you with this one, he was taken off the medication. Now, what do you think of that, everyone? This is OET medical writing. This is what you need to be able to do. You need to be able to describe the order of events, what happened clearly and concisely in a way that's accessible to the reader. And I'm only using a few time references like after. In the one above, first and when. So the timeline is clear, everyone. All right. Now, I could say the medication was discontinued as well. So there's a few options there, absolutely. Now, 2014 to 2018, no further hair loss, intermittent hair growth. All right, let's think about that. So now we're going to use then, everyone, then. I'm going to show you how to use it mid-sentence. And we've got a time period. So you really got to be careful about the time period. It's 2014 to 2018. That's 4 years. We're going to use simple past again because we're still talking about the past. So his condition then, so that's how you use then, everyone. It's like an adverb. His condition then something. We need a verb. His condition then. Now, think about this. This is a really hard word, everyone. I'm going to leave it open to you. What happened during this 4-year period? No further hair loss. You need a synonym here. What happened? What happened during this period? He didn't have any hair loss. So that means his condition was what? Improved? Yes. There's another word. He's no longer, he had hair loss, then it stopped, everyone. Think medical word. Give me a medical word. Aha, coming through. Stabilize. There you go. Well done, everyone. His condition then stabilized. So this is where your vocabulary is important, right? It stabilized for approximately 4 years. So we can summarize that time. And now in the case notes, we've suddenly jumped up to recent times. So just in a few sentences there, we've described Jake's past history, which we needed to do. And then we've got no further, with no further after that, with no further hair loss after 2014, and some regrowth, right? Intermittent regrowth. We could have used it and intermittent regrowth. Different choices. With the case notes, everyone, when you're summarizing case notes, I would always advise you to search the words in your case notes. Find the key words that you want to use in your writing. Sometimes, if you've got the vocabulary, you're going to use synonyms. However, if you're not sure what an appropriate word would be, we'll go with the case notes. You can see here, we're borrowing a lot from the case notes. Remember, the task question says expand on the case notes. So you're going to use a combination of words from the case notes, but you're also going to bring in some of your own words as well to add your voice. Words like stabilized and experiencing and presented. And then you get the right balance between the two. Okay, next one. Let's continue. December 2018, return of anxiety and pronounced hair loss. Pronounced, that means significant hair loss. At the general checkup, reduced 6 kg of weight over the last 2 months. Remember the recent prep hour. We did weight loss, everyone. Let's look how we're going to summarize this one. So in the last year, over 2 months, there's our time references, everyone. In the last year, over 2 months, suddenly we're going to use a little bit of present perfect, everyone. And we're even going to use a little bit of past perfect. We have an opportunity here. We can show the OET examiners our skill with verb use. Very important. So in the last year, hair loss, something. Now, what happened in the last year? So really what the writer is trying to say with present perfect, up to now. So in the last year. So we're now going, when we're saying in the last year, what we're really referring to here is from December 2018 up to today. So we're talking about a time period. So when we talk about time periods, we're going to use present perfect. So we've got hair loss was significant. That's quite good. That's quite good. Has resumed, that's quite good. Redeveloped. Lots of great options coming in, everyone. Reoccurred, I like that. So you guys are doing really well. Excellent work. I'll just put this in. All right, I'm just checking. Resumed, excellent. So some great words. Has returned, yes. And I think that's what I'm looking for. In the last year, hair loss has returned. Why am I using, I could use simple past, but because I'm saying within the time period up to now, means it's still ongoing. Has returned. And over 2 months, Jake's weight, what happened to his weight over the last 2 months? But remember, this last 2 months is different, everyone. The last 2 months means prior to December 2018. So not the last two. This says last 2 months, but because the date is 2018, it doesn't mean from now, it means before 2018. So we must use past perfect, everyone. In the last year, hair loss has returned, and over 2 months, Jake's weight, we've got decreased, yes. Can't use has been, in this case, Rupinder, has returned, because it's not passive. Nothing made it return. So we use active. Well done, Kwa, had reduced. Well done, Abdullah Ali as well. And Maria. So a lot of people getting this. Had reduced by 6 kg. So now we got present perfect and past perfect in one sentence with 2 distinct time references. Okay, let's continue, everyone. A lot of people are saying has decreased, but we don't really want to use has decreased because it's not up to now. Present perfect is up to now. Past perfect is up to a past date. You need to be careful about this. All right, let's do a few more, everyone. Now, then what happened to Jake? December 2018, he decided to try homeopathic treatment. But in February 2019, no results of the homeopathic treatment. And as this arrow means as a result, student increased distress. Let's have a look at that. Let's think about the order again. 1, he had homeopathic treatment. 2, it was not effective. 3, he became distressed. I really urge you to make sure you understand the relationships between ideas. If you can understand that, read it carefully, you'll be able to write more effectively. We're still going to use simple past here because this isn't ongoing. These are past events that are over. All right, so let's have a look. Now we've got homeopathic remedies, right? Decided to try homeopathic treatment. Something taking homeopathic remedies in December 2018. We need a simple past verb, everyone. But something depressed 2 months later when, another one there, when there was no improvement. A Yosh, excellent. He started taking homeopathic remedies. So started is great. Started plus your gerund. He started taking these remedies in 2018, but you could say was depressed, but that's something that developed. So I'm going to use past tense of become, but became depressed 2 months later when there was no improvement. The timeline is starting to make sense. We can see the progression. Let's continue, everyone. May 2019, checkup. Now, he started drinking. We saw that in the image I brought up before. And 28 units per week. All right, so this is a result of his distress. And then in June to July, he had extreme anxiety during exam time. So this time we've got a period over the recent school exam period. Sherry asks, is became acceptable? Well, it's A formal word? Yes, Ray. It is. What I'd say, don't say he got depressed, got's a problem, but became is a formal word. Sarah says, would it be safer to use simple past if I'm not sure about past perfect or present perfect? Depends on the situation. Depends on your situation. You're right, Sarah. These things are tricky. So practice and try to build your confidence over time. But quite often simple past can be used. I'm going to show you how to use both, everyone. Over the recent school exam period, Jake, something extreme anxiety. Now I'm going to use present perfect here, I think. Or no, I might not because it's ended. So I could say has suffered from. So I got two choices. There's your example, everyone. I could use has suffered from or suffered from. So yes, Sarah, quite often present perfect and simple past are interchangeable. So over the recent school exam period, Jake suffered from. Now I'm using simple past because it's over. We are now in August, right? So that's why we've gone for simple past. Now you could even use past perfect, had suffered from. So you do have verb tense options there. And a worsening of hair loss. Hair loss increased. Notice arrow up, but that means it worsened. His alcohol consumption, I'll put this in for you, has increased to 28 units per week. Now here, I could use increase. So that's English language. A lot of people are putting increased. That's correct, everyone. So you've got options. Sarah says during the recent exam period. That's absolutely fine. Yep, lots of good comments coming in. Well done, everyone. How about you if you're watching the video right now? Are you able to answer these questions? Don't forget to pause it and try to work it out. Okay, now we've got today, everyone. August 30, 2019. Student concerned about transition to university and independent living. He's going to go to university. So now we're going to use simple past. We don't need a time reference here. Simple present, sorry. Jake, help me out here, everyone. Jake, something anxious about his transition to university and about living independently. Jake, what? Jake, something anxious about his transition to university. That sounds right, Achana. I see your comment. Yes, Shreya, Jake is anxious because now we're talking about today. He is anxious, not was anxious. This is a current situation. We want to use present tense. A few people are putting in was, but we really don't want was here because we're talking about today. We want to make this information recent. It's a mood. It's not going to change. Jake is anxious about his transition to university and about living independently. Last thing, everyone, we're going to use our modal verbs, would and could, for a polite request. We need a letter to the university medical practice to monitor and organize special exam arrangements. So what are our polite verbs, everyone? I something greatly appreciate if you something monitor his condition and ensure special exam arrangements are made. We need our polite verbs. Pradesh has come in with would. Yes, but we don't need the V verb, the B verb, because we're using active. I would greatly appreciate it if you could monitor his condition. There we go, done. Okay, so well done, clap everyone. Well done. So now let's have a look at the letter. And let's just check for our time references. Let's go back one. I'm writing to, I'll just get my spotlight. I'm writing to introduce Mr. Jake Peterson, an 18-year-old student at this school who is about to start studying at Marchbank University. Jack presents with hair loss and associated depression and anxiety. So we've summarized his case. Now we've got our references, Jake, our time references. I'll just underline these as we go, just so you can see how it works. Jake first presented with hair loss when he was 13. He was referred to a trichiologist specialist who was unable to determine a specific etiology. He was prescribed steroid cream, but after experiencing personality changes, aggression, sleep loss, he was taken off the medication. His condition then stabilized for approximately 4 years. In the last year, another one, look at these time references. In the last year, hair loss has returned, and over 2 months, his weight had reduced by 6 kg. He started, that verb tells us when an action started. He started taking homeopathic remedies, but became upset when there was no improvement. He was referred to a counselor, but failed to attend the appointment. You can see no signal words here, everyone, just the facts. Over the recent school exam period, he suffered from extreme anxiety and the worsening of his hair loss. His alcohol consumption has increased. He's anxious about his transition to university and about living independently. Just the one, everyone. Therefore, I would greatly appreciate if you could monitor his condition and ensure special arrangements are made. So here's an example, and this was the point of today's lesson, everyone. Use your signal words, yes, but use them sparingly. If you really want to write like a health professional in the way that's acceptable, really focus on your timeline and your verb tenses. If you can put a big effort into that area, it's also the hardest. It requires serious practice. If you put a big effort into that area, your writing will improve a lot, everyone. It will improve a lot. All right. Any questions, everyone? Any questions? I'm going to jump through to so practice, everyone. Practice, take your way through. Join the dots on the way. Submit writing. If you join one of our courses, everyone, we'll show you how to do all this stuff to perfection, and you'll get a successful result, everyone. All right, and a couple more things to tell you before we wrap it up, everyone. Some success stories coming in. Congratulations to Rima. Look at these scores, everyone. 430, 380, 430, 390. Pass with God's grace. Wonderful. Congratulations to Pauline out there in Zimbabwe. Pauline got above 350, and she's on her way to Ireland to work as a nurse. Wonderful to hear. And I'm going to show you something else, everyone. Very important thing. I'm just going to bring up our website, everyone, and I'll answer any final questions that you may have. So this is the OET Online website, everyone. Guess what, everyone? End of year sale. Woo! We're having a special, everyone. So come along to our website, everyone, is my advice to you. Come along to our website and end of year sale. Free mock tests on selected courses, everyone. So if you come along and check out our courses, you'll see we've got, if you enroll in our ultimate course, you get a free all skills mock test. Platinum, you get a writing, reading, and listening mock test. Standard, a free reading and listening mock test. So if you're planning for the future, This sale will go into January next year, but I suggest to you, sign up and take advantage of our sales. If you want to know where that is, everyone, check us out here. I'll just put the link. Make sure you do that. Take advantage of those sales. How does that sound, everyone? Sound good? It's been a tough year in this year, so we're trying to help everyone. Type in a yes if you're interested in joining one of our courses and getting a great deal. All right. That's where you do it, everyone. Now, I'm just going to answer the final questions that are coming through. Shara says, medicine on brackets, acceptable, yes. And check the OET Center ones, you'll see it. OET Center tasks, you'll see that quite a lot. So just look at some example model letters to guide you. Dana says some tips for reading. Join our reading courses, Dana. That's going to get you a long way. Mehmet says, my last speaking was 320, writing 350. Wish you luck. Good luck, Mehmet. All the best. All right, I'm trying to get to all those questions. I think I've got them all. Ali says, are you my secret Santa? I hope so, Ali. That's very funny. All right. Melwa says the purpose was not stated in the first paragraph. I was very clear to the reader, Melwin, what was required. The patient was going to transition to university, so I would say it was very clear. All right, and I think I've got those questions. Ali says, how do we handle abbreviations we don't know? Well, hope that they're not too significant, but you've just got to use your medical knowledge. The OET does use common ones, so hopefully you'll be able to relate to most of those. Fatima is interested in nursing courses. Excellent, Fatima. We have wonderful courses for nurses, and we do nursing. Our nurse classes are nurse only every Friday. So come and check out our great range of course options. Nista says, are values in the brackets counted? I mean, every word's counted, more or less, but remember that 200 words is an approximate number. So you've probably got a 10% leeway there. Okay. I think I'm going to wrap it up, everyone. We've gone, the time has passed. It always goes very fast. But I'm going to be back in the new year, everyone. So from me to you, have a wonderful Christmas. Have a wonderful exam. Fingers crossed for you if you've got results pending. Next two exams, December 19, January 9. Good luck, everyone, for those ones. If you need help, you know where to come, oetonline.net.au. And I'll be seeing you again live on YouTube and Facebook in January 2021. Have a good one, everyone. Bye for now.